We have been able to reduce the cost for more than, I think, 70-80% of the market cost. Today, I think every other person can afford that test. We have partnered with, I think, nearly 400-500 doctors and they're the top interventional cardiologists across multiple cities. As a founder and looking after the business, I think more than the market for us, it's more of what kind of impact are we creating here.
Hi, joining us today is Sambit Ghosh, the strategic force driving business growth at SmartQR. As a Chief Business Officer, Sambit is known for his strong marketing insight, partnership building expertise, and ability to translate consumers' needs into scalable business opportunities. His leadership ensures SmartQR solutions reach the right market with clarity, value, impact. Hi, Sambit, it's a pleasure to have you on the podcast here.
Thank you so much.
So, what are the application domains of INGENE and Smart PGX solutions?
Sanjana, I think that's a very broad questions that you asked here. So while building Engine, the idea was to build a platform technology. And when we talk about platform technology, I think the applications across the entire diagnostic domain is huge. So we started off with CVD as because it's one of the larger problems in the country. But with the platform technology, I think the applications are a number of. So we can get into any disease diagnostics or any therapeutic areas. So for this year, I think we'll be launching Onco. We've already launched CBD. We'll be getting into neuropsychiatry and pain. And then later on, I think we'll be evolving ourselves into other chronic functions and other NCDs altogether. So overall, I think Smart PGX and Engine will technically bring your entire IPD domain into OPD market, and the possibilities out there are endless.
So, who do you think can be benefited by INGENE and how?
So, Dhanjana, as we spoken earlier, that we're building a platform technology which is getting into precision diagnostics through pharmacogenetics domain. And today, honestly, if you see the larger developed nations, all the doctors there have a larger turnaround on their patients because they get into a very precise medicine doses, precise drug that has been inhibited to the patients. So with this product, we have been able to get this from IPD market to OPD market. So today, whenever we hear the word genetics or genomics, we only think of the ultra rich because the affordability, the turnaround time, the cost. But today, we have been able to reduce the cost for more than, I think, 70-80% of the market cost, and taking the turnaround time to intraday, which earlier used to be at least 7 to 10 days for you to get your reports. So I think today, with this, engine could benefit the crowd starting from tier 1 to tier 5 towns, cities, villages. Even for doctors, it will be a much larger application because now they would be able to cater to a larger cohort of patients, get into more of inner diagnostics. The precision medicine will really help the practice because the patient will get treated faster, will have a less turnaround time on the report delivery. And also, I think from the cost perspective, I think a lot of patients will be able to now, not only patients, I think even healthy individuals who wanted to understand how a particular drug really works in the body. I think everybody could just go and get the test done. And I think with the price, which is maybe at 2,500, $3,000, today I think every other person can afford that test. So I think the application is an.
So, Sambit, you have started on this cardio profile and with INGENE. So, I want to know how big is the market in India for that? Like, how are you going to target the Indians in that way?
Thank you, Sanjana, for I think you have pinpointed the right question out here. Um, Being in India, I think the real Bharat, which is not restricted to your top 5 metros, we are blessed with more than 150 crore population, and cardiac, I think cardiology overall or any cardiac related disease is one of the largest challenges today in the population. Today we see younger generation, people of 30-year-old, 25-year-old getting cardiac arrest, suddenly falling down and losing. It's a life-threatening situation out there. And with us, being able to take this product from the IPD to the OPD market and make it into a point of need, into a point of care situation, I think the market has expanded both horizontally and vertically for us. So, just to give an idea, there are approximately 2,500 cath labs in India, which needs, and there are approximately, I think, 10, 15,000 interventional cardiologists. Every cath lab could have one of those machines installed. Every interventional cardiologist could have one of the devices installed. They see a number of patients. And also, people would just come and understand and get their profiling done, get their variance checks. So I think it's a tremendously huge market for us. And more than as a founder and looking after the business, I think more than the market for us, it's more what kind of impact are we creating here, making those very, very important test accessible to the crowd. I think that's what is the motto of the company, rather than just, obviously we run a company, we do not run an NGO, so there is a profit aspect to it, but we do not just want to earn profit, but it has to be profit with an impact. So the consumer base is huge. We have slashed down the rates by 70-80%, and I think there's a huge possibility out here, and this being a platform technology, I think the possibility is endless.
That sounds great. So, Sambit, considering that you've given me a new insight about your product and company, and you guys have just launched recently. So, where do you think you guys have reached till now?
From the perspective of INGENE, which I think we have launched 15, 20 days back, the market response is tremendous, trust me.
Oh,
Sometimes
that's nice.
I feel like that we might have introduced another Gen AI chip in the market, because that is the kind of response we are getting. Uh, we have partnered with, I think, nearly 400-500 doctors, and and the top interventional cardiologists across multiple cities. And they are really, really looking forward for us to install the device as soon as possible. But again, with the kind of resources we are planning to build and the scalability that we have right now, I think that kind of deployment would at least take us a month or two to really reach that scale and market. But yes, I think the acceptance is there. The market is quite huge, and the doctors who are are actually the end consumers for us are the doctors, because they will be prescribing. I think there's a huge interest for them. And from them, when I say, I'm talking about the top 200 cardiologists in the country itself. And today we have already placed ourselves across, I think, 7, 8 sites in the last 15 days. The samples are pouring in tremendously. The scalability is completely visible to us, and we see that within the next 365 days, which is a year down the line, I think we will at least be deploying 700-800 devices if we don't run out of our capacity, and I'm sure we'll be running out of our capacity. But yeah, I think the market and everything has been very blessed when it comes to deployment of INGENE.
So, Samir, what is the market thinking of INGENE? So, what's the acceptance and response and speed like?
So I think from the doctor's perspective, response has been tremendous. And also, let me give you a viability from the patient's perspective. The patient wants personalized care, correct? And with personal medicine, personalized diagnostics, you are not just another, prescription. You are now, it's more care driven. Now it's more therapy driven for the patient. Makes it very, very intriguing for the patient as well as for the doctors also, because the practice is improving tremendously, and also for the doctors, with better practice comes better outcomes. I think the market acceptance has been really, really nice. We have tons of order books in the pipeline. Like I told you, it's obviously profit with a purpose, profit with an impact. So obviously, as we are there to make money out of it, obviously we'll be making a tons of money out of it. But at the end of the day, it's all about how we can reach the end users at the very last mile, at the very last corner, how every patient could be benefited from personalized medicine, how every doctor could be benefited from personalized practice. So I think saying this, INGENE has a global perspective, INGENE has a global application, and with the platform technology we have created, I think the possibilities are endless.
So, Samir, this has been an incredibly insightful conversation. It's not just a diagnostic tool. I think it's how the healthcare industry will be transformed today. So, thank you for joining us here today, Sambit.
Thank you, Sanjana. I think, for us, the idea is pretty simple. Not For us, patient is not just another prescription, it's getting them the right dose with the right medicine. And at the very first time they come to the clinic. So, transforming your entire IPD into OPD, and we've been able to achieve it. And I hope that with this, we will be able to reach a lot more people.
I'm sure you would.
And they would get them tested. Thank you so much.
Thank you.